Welcome. My name is Terry Tropin, and today I'm going to talk about CPT coding for coronary artery bypass grafts, commonly referred to as CABGs. First, let me introduce myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an AHIMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College for over 20 years. I have also written books on coding. These books are study guides that help summarize the confusing coding guidelines. My books include one on E&M coding, one on ICD-10-CM, one on ICD-10-PCS, and another on external cause coding. These are available on Amazon. If you enjoyed this video, and I hope you do, be sure to hit the like button and click on my picture at the lower right-hand side to subscribe. So, what is a coronary artery bypass or CABG? Veins or arteries are harvested from other sites in the body to use in coronary artery bypass. They're taken from other places and used and grafted onto the heart. The harvested blood vessel is grafted to the outside of the heart to bypass or go around an area of blockage, such as for atherosclerosis. A single vein or artery may be sutured at sites of disease to more than one coronary artery. The important part to remember is the codes are determined by the number of vessels used as grafts, the arteries and veins from elsewhere, not the number of coronary artery vessels. So here are the questions to an overview of what I will be discussing. In order to code for a CABG, you need to ask these questions. Did the graft include arteries, veins, or both? How many veins or arteries were used? Is harvesting the vessels separately reportable? What other procedures were performed? I'm also going to talk about the guidelines for co-surgery in CABG procedures and include some practice. It's practice at the end of the video. So let's discuss each question. The first question concerns which vessels are involved. Arteries only, veins only, or both. So if it's only veins, you go to the section venous grafting only, 33510, 33516. If it's arteries only, go to the section entitled arterial grafting, 33533, 33536. If it is both, you code first the arterial graft from these codes, and then there is a separate section of add-on codes for combined arterial and venous grafting. And that's 33517, 33523. So let's look at the second question. How many venous and or arterial grafts were used? So for arteries, there's separate codes. This is how many vessels. So you have one artery, two arteries, three arteries, four arteries. 33533 to 33536. Now if it's only veins, you have separate set of codes, and again it's 1, 2, 3, 4, 5, 6, beginning with 33510 to 33516. So again, if both arteries and veins are used in the grafting procedure, two codes are required. First, a code from the artery, and these are the ones we talked about before, 33533 to 36, depending on how many. And then you have an add-on code from a different section by the number of veins used. Now again, the add-on codes for veins also list specific numbers of vessels used. So you have, this is 1, this is 2, 3, 4, 5. So the next question is harvesting the vessel separately reportable? Sometimes the harvesting procedure, the obtaining the blood vessel to use in the grafting procedure on the heart, Sometimes it's part of the CABG procedure and not reported separately, but sometimes it can be reported separately. So it's important to look at what's excluded and what's not. First, let's look at arterial grafts. The guidelines state that harvesting of these vessels is part of the CABG procedure and not coded separately. So the internal mammary artery, also called internal thoracic artery, gastroepiploic from the abdomen, epigastric, and some other sites. So these, if this is the source of the grafting tissue, don't report it separately. But there are some that can be reported separately. Use a separate code, an add-on code. So upper extremity arteries, 35600, that can be reported separately. So in this case, one for the CABG procedure and one for harvesting the artery, obtaining the artery to use in the graft. Now, there seems to be an inconsistency in the guidelines. So the introduction to the section for arterial grafting for coronary artery bypass, the first paragraph says the codes include the use of the internal mammary artery, gastroepiploic artery, epigastric artery, radial artery, and arterial conduits procured from other sites. The next paragraph says procurement of the artery for grafting should not be reported as a separate service or co-surgery except when an upper extremity artery, e.g. radial artery, is procured. Now, so it says don't use. So is harvesting of the artery separately reportable? Well, there's an add-on code for it, so that pretty much says, well, yeah, you can do that. 35600, an add-on code, harvest of upper extremity artery, one segment for coronary artery bypass procedure. So it says specifically in the code description that it's for a coronary artery bypass procedure. Now let's look at harvesting for veins. So if it's a saphenous vein, the guideline says no, you don't code that separately. That's part of the CABG code. This is the most common site for a vein. On the other hand, harvesting of these veins can be reported separately using add-on codes. Upper extremity vein, add-on code 35500, femoral popliteal vein 35572. So these are yes, the saphenous is no. There are also guidelines concerning co-surgery. If one surgeon performs the bypass while another surgeon harvests the vessels, the guidelines state the first surgeon codes the bypass procedure, the second one codes the same code with the modifier 80. Remember, the modifier 80 is for assistant surgeon. So let's do some practice. If you'd like to code this on your own, let me read it, then stop the recording and restart it when you're finished. So a coronary bypass procedure uses 3 arterial grafts but no venous grafts. The physician harvested internal mammary arteries for the procedure. Questions. We'll go down each question. It's a good idea to go through the questions because this kind of leads you to the correct code, kind of step by step. So, graft done with arteries, veins, or both. How many venous arterial grafts were used? Is harvesting the vessel separately reportable? Okay, so we have 3 arterial grafts but no venous grafts. So question 1, grafts done with arteries, veins, or both? Arteries only. How many? 3. Is harvesting reported separately? No, this is an internal mammary, so that's on that list of do not code separately. So in this case, you're going to report 33535 coronary artery bypass using 3 arterial grafts, 3 coronary artery grafts. harvesting is not coded separately. Okay, that's a fairly straightforward one. Let's try another. Again, do this on your own if you wish. Stop the recording and start it up again. A coronary bypass procedure uses one venous graft and one arterial graft. The arterial artery graft was an epigastric artery. The vein graft was a femoral popliteal segment. So we're going to ask the questions. Arteries, veins, or both? How many? Harvesting. Okay, so let's look at the answers to the question. Arteries, veins, or both? Both. How many? One venous, one artery. Is harvesting reported separately? Artery, no. Venous, yes. Because the artery was epigastric, and that's on that list of do not report separately. The vein, however, is femoral popliteal, and that is reported separately. So in this case, we're going to do 3 codes. We're going to do 33533, one artery, add-on code 33517, add-on code for the main code is 33533, the add-on code 33517 for the single venous, and then harvesting for the vein only, another add-on code 35572. So remember, the add-on codes are always reported second. So the artery, harvesting the artery is not reported separately, but harvesting the vein is. Okay, so sometimes other procedures are performed with a CABG, and I'm going to talk about a couple of them. One of these is an add-on code for an endoscopy used with the harvesting of a vein. Note that the coronary artery bypass is specifically mentioned in the wording for the code. Okay, so this is an add-on code 33508, and it also says that this where the code is listed, this code is used only with 3510, 33510, 33523. So it's saying it's only used with these. You don't use it with other procedures. So another add-on procedure is a coronary endarterectomy. This is an add-on code, again, which also specifically mentions that it's for a bypass. So coronary endarterectomy, open any method, and it gives specific vessels, and says performed in conjunction with coronary artery bypass graft procedure. Each vessel. So each time, if it's multiple vessels using the doing this procedure, you're going to report it several times. Finally, CABG procedures may also involve percutaneous insertion or removal of a ventricular assist device, which is designed to help the blood flow from the ventricles, the lower chambers of the heart. So this is for percutaneous insertion. There's also a code for removal and repositioning in the 33990 to 33997. So here's another practice, a final practice. So this time we're going to use all of the questions. Coronary bypass procedure uses one arterial graft, 3 venous grafts. The physician harvested saphenous arteries for the procedure using an endoscopy with video assistance. The physician also performed an endarterectomy of the circumflex artery. So here are the questions. Arteries, veins, or both? How many of each? Is harvesting separately reported? What other procedures? So let's answer the questions. Arteries, veins, or both? Answer is both. How many? One vein. That should be 3 veins. 3 veins, 1 artery. Is harvesting separately reportable? No. This is a saphenous. How other procedures are performed? Endoscopy and endarterectomy. So you have 33533 for coronary artery graft, 3 plus 3 venous grafts, and then you have the endoscopy and the coronary artery endarterectomy. So notice that you have the endoscopy code for the harvesting, but you don't have a separate code for the saphenous vein because that's not reported separately. Okay, it is impossible to remember all the guidelines, so I suggest you write these notes in your CPT book. Write in the 4 questions. So again, it takes you down step by step by step to find the right code. Under the section Coding for Venous Grafting Only, make a note or highlight or whatever that saphenous veins are included, but the upper extremity and femoral popliteal vein are not. And then codes for arterial grafting in that section, write in a venous grafting also done and refer you to the add-on codes 33517, 33523, and also note the codes that the arteries that are included and those that are not. So that completes this video. If you have questions or comments, please feel free to contact me. If you enjoyed this video, please give it a like and subscribe by clicking on the picture in the lower right-hand corner. And again, here are the books I have written on coding. These are available on Amazon. You can click on the link, or you can just go to Amazon and type in my last name, Tropin. Thank you so much for listening. I hope to have more lessons up soon. Thank you.